Tonight we're going to talk about disease management. And I said earlier I was curious of how many people might participate because the diseases we're going to talk about tonight aren't, not that any disease is fun, but these are the tougher ones. These are kind of the silent killers of the chronic wasting diseases. They're the ones that a lot of times we really don't want to address. Jeff Semler, who's usually in the chat box, double booked himself tonight, so Dr. Charlotte Clifford Rathard from Lincoln University might be joining us. She's a veterinarian. A lot of times we have people participating that are very qualified, as you know, to answer questions. Susan Kerr couldn't be with us tonight. I think she has something going on, but usually we have people that can assist us in the chat box. So these are the diseases that we're going to talk about tonight. The chronic wasting diseases of sheep and goats. CASEOUS lymphadenitis, ovine progressive pneumonia, caprine arthritic encephalitis, JOHNE'S disease, and SCRAPIE, a little bit different than those other four, but definitely fits that category as well. And again, I'm going to say I don't think these are diseases we all like, and again, we don't like diseases, but that we don't always want to address, or we're not willing to admit the extent of the problem that they may be. This is the first presentation I've done on these diseases, so I spent some time doing some research, particularly on some of the testing procedures for these. So why should you even care about these diseases? Well, I think Angela's question in the chat box earlier, an animal that got sick and died and she never knew. I'm not saying that her goat had any of these diseases necessarily, but a lot of times when we have unexplained deaths, they surely could be some of these diseases. So we should be concerned about these diseases, and I don't think it matters whether we're talking sheep, goats, meat, fiber, dairy, breeding stock, whatever. I think they're equally important to all of them. We have animals that sometimes that die and we don't know why. When we decide to do some testing, maybe to control or eradicate one of these diseases, a lot of times we end up getting rid of animals that have really good genetics. When these animals don't die from these diseases, we may end up culling them. They don't do as well, they're not as productive. Poor animal welfare, problems with their carcasses. Those are all production economic issues. Then the other, if I take a bigger picture, the problem with these diseases is we can lose sales. We can lose breeding stock sales. Increasingly, we've got people that want to buy animals with certain disease-free status. It definitely affects our export market. The other thing to look at, if you're a producer who wants to sell breeding stock or wants to sell show animals, if you set the bar higher for animal health, you should create a higher demand for your animals. Hopefully that results in an increased price and an increased profit. I've had people say, well, you know, I want to buy from you because you maintain a closed flock. Well, a closed flock, a closed herd is a really good thing, but having some verification that you're free of these chronic wasting diseases is also very good. Again, looking at it from the big picture, from the standpoint of consumers, increasingly they care about the health and the management of the animals from which they're eating or consuming products. They want our animals to have impeccable health. And the thing that always concerns me is what happens when the media all of a sudden says you can get this disease if you eat meat or milk from a sheep or goat. Remember when mad cow disease, when that hit the media? And Oprah Winfrey said you shouldn't eat beef. That actually had a big impact on the beef market. It doesn't have to be true. So if we can eradicate, for example, we're getting very close to eradicating SCRAPIE, well then that's never going to, the media is not going to be able to do that. We're not going to be able to suffer that consequence. So what consumers think Both reality and perception has become increasingly important, and that's where these diseases are of particular importance. So the first disease I'm going to talk about is caseous lymphadenitis. We more commonly call it CL. It's also called boils. In Australia they call it cheesy gland because that's what the material in the abscesses looks like. So essentially it's abscesses. So CL is an infectious bacterial disease caused by Corynea, I don't even know if I'll say it right, Corynea bacterium pseudotuberculosis. That's the bacteria that causes it. CL is a very common infection in sheep and goats. It would be interesting to know both the percentage of flocks and herds that have it, and then within those flocks and herds the percentage of animals that are infected. It does cause significant economic losses. I don't know what year this statistic is from, but CL accounts for 23% of the carcass condemnations. In other words, that when that carcass is evaluated in the meat plant, it is removed from the food supply. We have some economic data from the past that shows the cost to the sheep industry. Treatment is generally ineffective. In fact, that's going to be true with all 5 of these diseases. In the case of CL, even though it's a bacterial disease, antibiotics can't penetrate those abscesses. So treatment is generally considered ineffective. Of all these diseases, this is probably the one that people do attempt to treat, but it's probably not going to be very successful. CL has minimal zoonotic potential. In other words, it's not a big risk to people. People can get infections, but it's very rare. But just the fact that people can, again, opens us up to potential issues with consumers and consumer perceptions. CL is spread from one animal to the other through contact with the material in those abscesses, the pus. You can see the picture here of the goat. That abscess burst. That's the worst thing to happen on your farm, is for an abscess to burst. Or if they come into contact with anything that's contaminated with that abscess material. The bacteria can survive several months, actually I'm sure a lot longer, in the soil and environment. So there's that persistent source of infection. When the abscesses are in the lungs, because there's 2 different kinds of abscesses, internal and external, the bacteria can spread through respiratory secretions. So while it primarily spreads from those abscesses that burst, the external ones, it is possible through the respiratory system. Transmission through milk is rare. There's no evidence that CL can be transferred through semen. And what's important, and this is true for really all 5 of these diseases, is once an animal is infected, it is infected for life. The symptoms of CL, well, what makes essentially all of these diseases so difficult is that infected animals don't always show signs. In fact, I would say in most cases they don't show signs. In the case of CL, the sign that we see is abscesses, either abscesses near the lymph nodes, external abscesses, or in the body cavity, in the thorax or abdomen, the internal abscesses. So the external abscesses, which is what most of us are familiar with, these are superficial abscesses in the area of the lymph nodes, just slightly under the skin. The abscesses are filled with a pasty, thick, yellow-green pus. This is the abscesses that are primarily responsible for disease transmission. And the external abscesses are more common in goats. The internal abscesses, it's very difficult to know when an animal has those because you can't see inside of the animal, and the symptoms are very generic. The only way you can tell if an animal has an internal abscess is at necropsy, a post-mortem exam. So the animals that have the abscesses on the inside show these chronic wasting symptoms, weight loss and poor productivity, generally while maintaining a normal appetite. They could have other symptoms, anything from mastitis to respiratory problems to neurological defects, depending on the location of those abscesses. In sheep, which is where the internal abscesses are more common, we call this the thin ewe syndrome, when we have ewes that just waste away. CL is one of the likely culprits. So goats, it's mostly external. Sheep, it's mostly internal. So how do you tell if your animal or your farm has CL? Two ways. One is to do a bacterial culture and one is to do blood testing. The bacterial culture is the only way to know for certain if an animal has CL. What you do is you submit the abscess material, the pus, for culture. I think some veterinarians can do it, but for the most part this is something you would submit to a state diagnostic lab, either a state Department of Agriculture or a university. You can do it yourself. You can lance the abscess and aspirate it. You got to be really clean, or you can actually make things worse because you can, you can cause other animals to get it because you're not clean and you leave some material behind. You can have the whole abscess removed, have a veterinarian do that. Anytime an animal has an abscess, you should have it cultured. Even if you do blood testing and it says it's negative, you should still have it cultured. A lot of people get really scared about abscesses and they're afraid, they have to get rid of the animal or they should get rid of the animal. What's important to understand is not all abscesses are CL. I know on my own farm, over the years, I've occasionally had an abscess that I've lanced and had tested, and it's never been CL. A couple of examples, and this goes back, 30 years, but when they cultured abscesses from goats, this other bacteria was cultured 3 times more than the CL, the bacteria that causes CL. This was published by the American Veterinary Medical Association. In the buck tests we do at our research center, we do get abscesses. I'd say only about an average of 1 a year, and about half of them had been CL and the other half haven't been. So again, not all abscesses are CL. A lot of times you get an abscess from vaccination. I always ask our consigners not to vaccinate up on the neck because that's a similar location as a CL abscess. And then I have to test it. You can also do blood testing. You're looking for antibodies. The ELISA test is what's typically used. This is really kind of a herd test to kind of screen to see if your herd has CL rather than to diagnose an individual animal. It's best to diagnose an individual animal by doing a bacterial culture of the abscess. And the one thing to understand about testing, not just for CL, but for all of these diseases, is all of these tests have limitations. They have false negatives, they have false positives. And a positive test does not mean the animal is infected. It usually does, but not always, and the negative test does not always rule out an infection. There's kind of some other issues. The other thing about CL is because you can vaccinate, if you do testing, you cannot differentiate between an animal that got a natural infection or natural exposure versus vaccination. So that's an important issue as you look to control and or eradicate CL. So let's talk about controlling it. And this is a decision that all producers need to make. Is this a disease that I can live with? And there are certain things I can do to minimize the effects, or is this a disease I want to eradicate? I want to eradicate because I think it's affecting my productivity. I want to eradicate it because I want to be able to sell animals that are free from this disease. The first way to control and manage CL is, and this is again is true of all these diseases, is to maintain a closed flock or herd, or as close to a closed flock or herd as you can. Don't buy in CL. Never buy an animal with an abscess. Inspect, do a close inspection of animals. When you have animals on your farm and you see an abscess, and you're going to see abscesses, it's normal. You know, whether it's CL is a different thing. But if you see an animal with an abscess, you need to isolate that animal before that abscess ruptures. And we should, again, you should test all abscesses. Remove the abscess by the vet, lance the abscess, get a sample, flush it with iodine. A lot of people are advocates for using formaldehyde to flush it out. Put the animal on antibiotics. Obviously, if it's CL, it's not going to have an impact, but some of these other bacterial causes. And put the animal in isolation until you get the results of the culture. In our buck test, and so I noticed somebody asked a question about consigners. Those are individual producers that nominate or put bucks in our test, and we call them consigners. But once an animal has an abscess, we will take it out of the test. We will take a sample. We'll put that buck in isolation and wait for the results of the test. If the test is positive for CL, that animal has to leave the premises. We'll take it to the sale barn, or they can come pick it up. If that animal, if that abscess is caused by another bacteria, we'll return that animal to the test. If you have animals that keep having abscesses, even if you're not in the mode of, oh, I'm going to get rid of CL, but if they have reoccurrent abscesses, you should cull those animals. We had a buck this year. He wasn't in the test. He was in our pen versus pasture study that developed an abscess. We ended up slaughtering that goat, and he had, just to give you an idea, he had multiple abscesses on his carcass. If you have CL on your farm and you want to keep it from spreading, you should keep infected animals separate from clean animals. You should practice good hygiene to prevent the spread of infection. In sheep, one of the most common ways to spread CL is shearing. That's why I have a picture of a shorn sheep here. So good hygiene with shearing. Not having objects around the farm that then can cause to penetrate the skin and things like that. Early weaning, isolating young animals from mature animals. Mostly young animals are most susceptible for acquiring the infection, and they acquire it from mature animals. So separating the young from the old will help. In fact, in a lot of these diseases, not all of them, but a lot of them, or a lot of disease problems in general, it is a good management practice to wean early, to separate, because very often the mature animals are the source of infection for the young animals. Even a disease like coccidiosis, you shouldn't mix animals of wide varying ages. The older animals will serve as a source of infection. As I mentioned, you can vaccinate for CL. The vaccination is not done to prevent the disease from occurring. It is to reduce the number of abscesses in your flock or herd. There is a sheep vaccine by Colorado Serum Company. A goat vaccine was developed and was put on the market last year. It's by Texas Vet Labs. You don't want to use the sheep vaccine on goats, so goats now have their own vaccine. And up to, before they had the goat vaccine, they did make they were able to make some vaccines, kind of homemade vaccines. Early weaning would probably be a couple of months, not past 90 days. And the thing about weaning is there's obviously pros and cons to weaning at different ages. Just understand from a disease standpoint, you're better off early weaning and separating young and mature animals and putting young animals in cleaner, more pristine conditions, whether it's whether it's a cleaner pasture in the case of parasites or a cleaner dry lot, in the case of CL. So yeah, with vaccination, you don't, let's say you started a brand new herd, you wouldn't vaccinate to prevent CL. You already have CL, the idea is to vaccinate to reduce the incidence. So I'm actually not a big fan of vaccinations, and there's a lot of differing opinions on it. I would think you'd have to have a pretty significant clinically diagnosed problem before I would even consider vaccinating. Let's say you decide you're going to eradicate CL. And to be honest with you, for each of these diseases, eradication is certainly what the recommendation would be. Very few people have actually done it. And I would imagine to some degree it's going to depend on why you're raising sheep or goats, what potential markets you have for breeding stock, whether you're interested in export markets. There's a lot of different things that can go into a decision of whether I'm going to ignore the disease, try to control the disease, or try to eradicate it. But let's just say we want to get rid of it. Cull all animals with abscesses. That is a no-brainer. Or in the very least, cull them all that have CL abscesses. So if I had an animal such as this goat with an abscess, test that abscess. And if you really want to eradicate CL, I would have a vet do it and get it off your premises so you don't have any potential to contaminate the environment. If that goat is positive for CL, get rid of it. Somebody asked a question about a goat testing positive for CL. Blood testing, if I was trying to eradicate the disease, I'd get rid of it. If I'm trying to control the disease, if it tested positive, I probably wouldn't get rid of it. If it ended up with an abscess, I would. Cull and necropsy, all suspect thin, poor-doing animals. Because, again, this is one of the diseases that can be a chronic wasting disease. Test all animals over 6 months of age and cull any that test positive. So that when that vet said get rid of it, if your goal was to eradicate the disease, yes, get rid of it. If your goal was to control the disease, maybe not necessarily. Separate it. If you need to purchase new animals, and this has to do with control and eradication, you need to purchase them from CL-free flocks and herds. Ideally, you want to know that the herd is free from the disease, and you would test 10 or more animals. That's not always possible, so you could simply test the animal that you plan to purchase, have it tested twice 30 days apart before introducing it into your flock or herd. Don't wait till you get it home to test it. Okay, moving on to the next disease, ovine progressive pneumonia, we call OPP. Internationally, there's a disease called Maidena-Visna, which is very similar. This is a very slowly progressing viral disease of adult sheep that may affect several organ systems of the body. It's a lentivirus, which means slow. It's a retrovirus. It's actually in the same family of diseases as AIDS. First discovered in 1923, about 25% of U.S. sheep were infected. Out west, range flocks were more likely to be infected. USDA has done a little bit of tracking some data on this disease. All breeds of sheep are susceptible, but some appear to be more susceptible. Texel, as shown in the picture here, Border Leicester, and Finn are a couple of examples. Some exciting things have been happening in the last few years with regards to OPP, and that's genetic information. Genetics affects susceptibility, and they've identified a gene. It's got a complicated name, TMEM154, but animals that have 2 copies of that gene are 3 to 5 times less likely to contract the disease. So that offers some opportunity for control. OPP can infect goats experimentally. We're going to talk about CAE. Those 2 diseases are very similar. Just like CL and the other diseases we're talking about tonight, no cure, no vaccine. The transmission of OPP is primarily through the ingestion of infected colostrum in milk. Same with CAE. Contact transmission may also occur in closely confined sheep. In fact, the folks at the U.S. Meat Animal Research Center that discovered the gene that affects susceptibility found that the primary cause of OPP was not due to the maternal effect, the colostrum in milk, but rather when the young ewes joined the infected breeding flock, when the young joined the mature animals. They have found that in utero transmission is rare. No one's demonstrated that OPP can be transmitted in the semen. A lot of diseases don't naturally cross the species barrier, but in a laboratory, when we purposely expose them, we've been able to do that. They've done a number of studies with SCRAPIE that they can do in the laboratory, but doesn't really appear to occur in the real environment. So goats can get CAE, goats can get OPP, and sheep can get CAE. Complicates the testing a little bit. They can cross-infect too. So if you have sheep and goats on the farm and you want to get rid of OPP or CAE, you need to look at both species. The symptoms of OPP, as I mentioned, it affects a lot of different body systems, so we have a lot of different symptoms, so which means it's really hard to diagnose. Most sheep will never show clinical signs of OPP. They won't show them under 2 years of age. If they do show them, it's most commonly over 4 years of age. We get that loss of weight and body condition despite normal appetite. Again, a wasting, what we call the thin ewe syndrome. I can't explain why that sheep's not doing well. She's eating, but she's just poor. Thin ewe syndrome, OPP, is another potential cause. Ovine progressive pneumonia, so obviously the respiratory tract is involved, and we get pneumonia-type symptoms. Lungers is what we call them. That lung infection can cause sheep to waste away. Udder involvement, decreased milk production, essentially mastitis, what we call hard bag. The udders can look perfectly fine, but there's little or no milk in them. They kind of feel meaty. Mastitis. Arthritis, just like CAE, can also occur in OPP. Central nervous system, not as common, but can occur, again, just like CAE. How do you diagnose OPP? Because the symptoms cross many body systems, because the symptoms are very similar, you cannot diagnose it by clinical signs alone. You have to do blood testing. And there's actually 3 different tests. The AGID and the ELISA test. Both of them tend to have pros and cons. One is more common than the other. There have been some newer tests, the PCR tests, and a little bit more specific on the ELISA test, looking in blood, milk, and other tissues for the OPP virus. So the only way you're going to identify OPP is by blood testing. And again, there's still limitations on tests, false negatives, false positive, things like that. And it's not that clinical signs aren't important, but they alone you can't really diagnose OPP alone on clinical. You combine it with blood testing. Eradicating OPP. It's not really a disease you want to live with. Most sheep flocks do not know the extent, if they're infected, nor do they know the extent of infection. So one way that I shouldn't say you can't live with it. People do things to try to control it. The first method, and you're going to find this strikingly similar to managing CAE, is because the primary source of infection is colostrum in milk, is to remove the lambs from birth and rear them in isolation, especially away from the ewes that tested positive for OPP. You feed the colostrum from negative ewes, or you feed a heat-treated colostrum. You artificially rear those lambs on milk replacer or graft them onto ewes that have tested negative for OPP. If you're not going to eradicate it, or you're in the process of eradicating it, but you're not going to cull all the positive U's, you need to keep the clean flock separated from the infected flock. That's complicated. That takes effort. When you do add animals to your flock, you should only add, and I think that's a typo, I don't think you want to add seropositive sheep to your flock. You want to add negative to the flock, so that's a typo. And to eradicate it, you want to test annually until you have at least 2 consecutive years of negative tests. The other method is to test all your sheep for the OPP virus, remove the positive U's and their latest offspring. Really, their offspring. Again, keep the clean flock separated from the infected flock. We've got to be concerned about goats because of CAE, OPP, and the fact that both of them can get both diseases. And I think I made the same typo, add only seropositive sheep to the flock. You're not going to get anywhere if you do that, so add the negative ones. I'll go ahead and make that change and upload this presentation. And again, test annually until there are at least 2 consecutive years of negative flock tests. Now, an alternative approach is to use this new genetic information, because the new genetic information means that we can use rams and breed them to ewes and produce offspring that are genetically more resistant, less likely to develop the OPP virus. Because one of the problems is, and this is true with all those diseases, let's say I test all my sheep for OPP, all my goats for CAE, and by God, my best producers tested positive. And I want to save their offspring. Well, that's hard to do that. And so with this genetic information, one of the suggestions is that you not automatically cull those lambs from those positive ewes, but breed those lambs to a ram that is going to confer immunity. Not sure what you mean by a congested udder. Okay, let's switch to CAE, basically the partner disease to OPP, a viral disease, a lentivirus, a retrovirus. Again, same family as OPP, same family as the AIDS virus. First discovered in 1980, and there is substantial evidence that CAE is widespread in U.S. goats. Washington State University is one of the diagnostic labs that does testing for CAE, and 80% of the dairy goats that they've tested positive for CAE. CAE, we think of, it occurs primarily in dairy goats, but it can affect any breed of goat. We're seeing it in meat goats. I know I had several years ago, I had a small herd of meat goats. I tested them all for CAE. Half of them had antibodies to CAE. We do a lot of mixing of breeds, moving of animals around. While we think of it as a dairy goat problem, it is also a problem with meat and fiber goats. Again, it's infected sheep experimentally, so they can get it. No known treatment or vaccine. Sometimes supportive treatments can benefit individual goats. For example, because it causes arthritis, something like aspirin and that sort of thing. CAE is transmitted primarily through the ingestion of infected colostrum in milk, about 90% of the infections. May be also transmitted from goat to goat through saliva, nasal secretions, urine, feces, blood, etc. It's unlikely to be transmitted in utero, during parturition, and breeding and embryo transfer. Does it mean not at all? No, but those aren't the likely modes of transfer. Again, CAE and OPP can cross-infect. What are the symptoms of CAE? Again, not all the goats that are infected that test positive will progress to the disease. In fact, about 80% of them won't. However, they're going to shed the virus. When a goat does develop clinical signs, they vary, and they begin when they're about 1 or 2 years of age. Unlike OPP, which only affects mature sheep, CAE affects both adults and kids. In adults, it's more of an arthritic condition, and kind of like OPP, it involves some different body systems. And in kids, it's more of an encephalitis or a nervous system disease. So in adults, the primary symptom is a joint disease, swollen knees or hocks, swollen joints, lameness, and then some of those wasting issues, the weight loss, paralysis, lycopene, pneumonia, hard bag, again, mastitis, production losses. In the kids, it's not that common, but it can occur. It affects kids less than 6 months of age, paralysis, seizures, and death. How do you diagnose CAE? Clinical signs and history, and doing blood testing. Again, just like OPP, there's two tests, two types of blood tests for CAE. Usually the OPP virus sometimes is used, and the first test is improved if the CAE virus is used. The ELISA test is considered more sensitive and more specific. The new test is the PCR test. It's looking for genetic material in white blood cells. Of course, the post-mortem exam, I think particularly with the kid form. As far as the question about the 80% of the goats, I don't really think I had that much detail on the information. I think the take-home thing is it was pretty high level of positives in the dairy goats that were tested, and it's who chose to test them. You know, the type of producers that chose to have them tested. OPP and CAE can both cause hard bag or mastitis. Obviously, mastitis is a very big disease, and the more common causes are some of the bacterial things we talked about last week. How do you control and eradicate CAE? Very similar again to OPP, is to take the kids away at birth, to feed them heat-treated colostrum and pasteurized milk. Test the herd, separate the negative and the positive goats, eventually cull the positive goats. Purchase breeding stock from CAE-free herds. Use testing to screen purchases. Test them twice. Semi-annual, annual testing of the herd, again, just like OPP, before you can get to be a negative herd. Okay, moving on to JOHN'E'S disease, paratuberculosis. It's a contagious, chronic, usually fatal disease that affects primarily the intestines of small ruminants. So it affects sheep, it affects cattle, it affects goats. There's both a cattle and a sheep strain. Goats can get both. We don't really know the prevalence, with the exception of SCRAPIE, we don't know the prevalence of any of these diseases in the sheep and goat population. You know, we get some indications of how widespread it might be with some programs, but for the most part, I can honestly tell you we really don't know, and we definitely don't know with JOHN'E'S disease. It has been confirmed in flocks and herds, though. We do know we have it, but we don't know the extent. There's no cure or vaccine for JOHN'E'S disease. And the zoonotic potential of JOHN'E'S is of concern because it's been linked to Crohn's disease. So this disease is important from that standpoint, and for the other reasons that we mentioned. The organism that causes JOHN'E'S disease is commonly passed in the manure. It typically enters your flock when an infected but healthy-looking animal is purchased, walks onto the farm. That infected animal sheds the organism into the premises. Other animals get infected when they swallow it in water, milk, or feed that has been contaminated by the manure. Young animals are the most susceptible to infection. The disease can be transmitted between species, so it's not species specific. Just as an example, if you get colostrum from a cow dairy, if that cow dairy has JOHN'E'S disease, and JOHN'E'S is considered to be more of a problem in dairy cattle, you could introduce JOHN'E'S disease to your farm. So what are the symptoms of JOHN'E'S disease? Again, just like the other diseases, they may not develop signs. They may be free from clinical disease for months, even years. In animals that do show clinical signs, it's the disease is affecting the intestines, the animal's becoming less efficient at absorbing nutrients. The symptoms are very generic, again, kind of wasting. A rapid weight loss despite a normal appetite. A lot of other diseases can look like that. Diarrhea is the telltale symptom in cattle, but not in sheep and goats. So you've got an animal that has persistent diarrhea and you think, well, it's Johne's. I'm not saying it's not, but it's not a specific symptom like it is in, or a common symptom like it is in cattle. Symptoms can be very similar to other diseases. They've developed basically a 4-stage thing for Johne's disease. In stage 1, there's no signs that the animal has of the disease. In the 2nd stage, it's completely subclinical. You know, nothing, you really don't see anything, but the animal may be shedding that bacterial. Stage 3 is when we start to see clinical disease. The animal's eating well, but it's losing weight, and we don't know why. If we blood test, we're going to be able to identify some of the infected animals. Stage 4 is advanced clinical disease. The animal's lost a lot of weight, it's weak, it's emaciated, it's shedding a lot of the bacteria in its feces, and it's going to die. It's very difficult to diagnose Johne's, and even more so in small ruminants because the testing is less reliable in small ruminants. There's basically 3 types of tests: organism-based, where you do cultures mostly from the manure, and then the PCR test, which is the new test for OPP and CAE, where they're looking for the genetic material, only they're doing the manure, not the blood. And then again, the very similar, same test looking for antibodies. Interestingly enough, there's some with the ELISA test, there appears to be some cross-infectivity with CL. And obviously a necropsy might help identify the disease as well. So how do you control or eradicate Johne's? Maintain a closed flock or herd. Don't buy Johne's disease. Of course, most of us, when we go to buy a new animal, we don't have a clue of the farm that we're buying from. That's why I personally believe that if some farms will start establishing these disease-free statuses, they're going to have a really good market for their animals. Since young animals are mostly the ones that get infected when they're young, how you manage your animals can help reduce infection. Reduce exposure of lamb and kids to adult manure. Once again, early weaning. It does pass in the colostrum and milk, so doing the same thing you do for OPP and CAE. Not feeding on the ground, that's a good practice no matter what disease we're talking about. Culling the most recent offspring from the infected dams. Separating the test-positive animals, again, from the clean herd. Testing and culling, you know, as we move down this list, we're moving towards not just controlling but eradicating it. And in some cases, you could have, it could be a significant enough problem to consider depopulation. And this could actually be true with any of the diseases. The most difficult aspect of depopulation is there a source of Johne's-free, OPP, CAE-free animals? That's the biggest issue with depopulation. Scrapie. This is the last disease I'm going to talk about tonight. It's a little bit different than the others, but at the same time, it's still one of those chronic wasting diseases. Scrapie is always fatal. It's a degenerative disease affecting the central nervous system of sheep and goats. Yes, depopulation means starting over again. Scrapie is part of a family of diseases that are called transmissible spongiform encephalopathies, TSEs. It includes BSE, which is mad cow disease. It includes CJD, which is Creutzfeldt-Jakob's disease that affects people. The NV means new variant. That was the one 10, 15 years ago that they thought was a result of mad cow disease crossing the species barrier. FSE is the one that affects cats, and CWD is chronic wasting disease, which affects deer and elk, and probably becoming a more significant issue in this country all the time. Scrapie's been around for 300 years. It is not a new disease. The first case of Scrapie in the United States was 1947. So it's been around 50, 60, 70 years. It affects mostly black and mottle-faced sheep, Suffolk, Hampshire, and breeds that they have intermingled with. There is a very low incidence in goats compared to sheep. If you look at over the years, the number of flocks that have been infected is not very many in goats. The prevalence of scrapie in the United States, unlike the other diseases that we mentioned, is very low. The issue is this is a disease that our country wants to get rid of. So we need that prevalence to be 0. And since 2001, which was when we began the latest scrapie eradication program, we've had an 85% reduction in the disease. Other countries have chosen either are free of the diseases we've talked about up to this point, or are trying to, or have disease management programs in place. We only have one for sheep and goats. All we have is the one for scrapie. We don't have much for the other diseases. There's no known human health risks to scrapie, and then of course there's no treatment or vaccine for any TSE. They're going to die, and they're going to die a miserable death. The scrapie agent, and there is different theories as far as what causes scrapie. The most widely accepted theory is a prion, P-R-I-O-N, which is a misshapen protein. But I'm just going to call it the scrapie agent. It's most commonly spread from an infected female to her offspring at birth via the placenta and placental fluids. And it could also be transmitted to any other animal that's in that birth environment that may come in contact with those fluids. The risk of transmitting scrapie via embryos and semen is negligible. It's why, for example, in our voluntary scrapie certification program, you can bring in a ram from any flock, whereas you must bring in ewes from certified scrapie-free flocks, otherwise lose your status. Experimentally, scrapie has been transmitted through the milk. There is also evidence that the scrapie agent persists in the soil. There was a situation, I believe, in Iceland where sheep had scrapie and they were depopulated and that land sat idle, and when they brought new sheep in, they developed scrapie. Only sheep with certain genotypes will develop scrapie if they were exposed to the infective agent. For example, the R gene, when you hear QR, that's for one of the 171 codon, that's the resistant gene. So if an animal is an RR or a QR, so they have 2 or 1 copy of that gene, if they're exposed to the infective scrapie agent, they won't develop scrapie. If they're QQ, susceptible, they will. They're looking to see if there's similar resistant genotypes in goats. And it's ongoing research, but we're not there yet. So what are the symptoms of scrapie? Scrapie, just like most of these diseases, the signs of scrapie vary widely, and it develops very slowly. I think you'll notice the theme to these diseases is that they cook in the oven for a while. They develop very slowly, which makes them very hard to detect, very hard to manage. And there can sometimes even be differences between sheep and goats. The first thing is a subtle change in behavior and temperament. Remember, it's a neurological disease. It's affecting the central nervous system. It's causing holes in the brain. Scrapie got its name because sheep used to rub and scratch against objects. Some of the other kind of unique symptoms, lip smacking, biting their feet and limbs, loss of coordination, weight loss, high stepping, hopping, swaying of the back end. They're excitable. It's a nervous system problem. Initially, it can be very similar to some of these other diseases that are neurological in nature, or you think that the scraping and the rubbing could be external parasites. So it can be similar up to a certain point of other diseases. So how do we diagnose scrapie? Well, the initial diagnosis is made on the basis of clinical signs and animal history. Animal history meaning, was that animal exposed? You know, when an animal is discovered to be infected with scrapie, the federal government will backtrack of where that sheep was born, where it came from. So that's what I mean by animal history. As far as diagnostic tests, the primary one is once the sheep is clinical, obviously it's going to be sacrificed. They're going to look at the brain tissue, and that picture shows the holes in the brains, but they're going to be looking for that prion. Sorry about the microphone. I think I had it away from my mouth. In more recent years, we have developed some live animal tests, looking for that prion. The first one was called a third eyelid test. It was in the lymph tissue in the eye. And then in more recent years, they've developed a rectal biopsy. Producers don't go out and have these tests done. If you're determined that you have an animal that's infected, they will do the rest of your animals. Because in the old days, if you had one animal that had scrapie, all of your animals were going to be depopulated. Now with these live animal tests and genetic testing, you know, you don't necessarily have to lose all of your animals. In 2001, we established, the federal government, the sheep industry, goat industry established the National Scrapie Eradication Program. Our goal was to get rid of scrapie. I'm trying to remember the exact years, but I know we're not that far off from wanting from eradicating it. And then after so many years of our country being free, then the international community will recognize us as being free from scrapie. There's only 2 countries in the world that are free from scrapie, and that's Australia and New Zealand. And we'd like to join them because it does affect international trade when you have scrapie in your country, both export and import. Unlike the other diseases, scrapie is a reportable disease. If your animal has it, if you think it has it, you need to report that to your veterinarian and to animal health authorities. So any animal that you suspect could have it. And the logical place is probably to start with your veterinarian. But ultimately the animal health authorities, USDA, APHIS. One of the ways that producers can help eradicate this disease is if you have an animal that dies, a mature animal, over 18 months of age, you just found it dead, is to submit its head for scrapie testing. One of the ways that the program has been able to reduce the incidence of scrapie is by doing slaughter surveillance, testing cull ewes at slaughterhouses. Well, for producers who don't market through those channels, they haven't been testing those. So if you market through non-traditional channels, they're especially interested in sampling some of those animals. The other way you as a producer help to eradicate scrapie is to comply with the mandatory animal identification requirements. All sheep and goats, well, it depends. The federal government has established minimum identification requirements for scrapie. States can have more stringent requirements. For example, in the state of Maryland, pretty much you just identify everything, put a tag in everything, even a wether, even if they go to the sale barn. The federal government requires all breeding sheep, all sheep over 18 months of age, to have scrapie ID when they leave the farm in which they were born in order to enter interstate commerce. If lambs go directly to slaughter, they do not require identification. Goats, if they're considered high risk, require identification. Again, states can be a little more stringent. The ear tags, like you see in this picture, are free. The applicator is free. You can call that number. If you are a sheep and goat producer, you need to have a premise ID for the scrapie program, and you need to get these ear tags. There are a few exceptions. Registration tattoos can suffice. And the other thing is a sheep producer, you can use resistant genotypes for breeding. This is a particular good idea for the high-risk breeds, such as the Suffolk and other blackface, but also for selling breeding stock. And you should consider enrolling in the voluntary Scrapie flock certification program. That's a monitoring program. You submit animals for necropsy. After so many years, I believe it's now 7, you're certified Scrapie free. You're eligible to export. And that's it. Those are the 5 nasty diseases.